Hi, I'm Erica Butler, and I'm a physical therapist at Center for Sports Medicine's C4 Sports Therapy location. Today I wanted to talk about hip mobility and its importance for runners. A lack of hip extension is one of the most frequently seen hip problems in runners. In fact, a large portion of foot, ankle, and knee injuries are often in part due to tightness at the hips. Why is hip extension so important? Lack of hip extension compromises posture by increasing the arch in your back. This leads to decreased core stability and often a shorter stride length. Also, a lack of extension on one side versus the other can cause imbalances, and the body will start to compensate. Compensations then lead to injury. I often tell my patients, if you don't have it the right way, your body will find it the wrong way. When running, your leg must be able to freely move in front and behind you without exaggerating the arch in your back. Look at elite runners. Their ability to extend powerfully through a large range of motion tends to lead to a huge stride length, which results in a more efficient yet powerful running. So first, we need to know where your hip health is. I'd like to show you a few simple tests to help you find out. First, kneel inside a doorway with your mid-back against the door frame. Here I have my client using a pole to get a better visual. The thigh you are leaning on should be vertical as well as your opposite shin. In this position, you will naturally have a small gap between your low back and the door frame. Now, tilt your pelvis or tuck your tailbone under so that space between your low back and the door frame disappears. Now, in this position, what do you feel? Do you feel a big stretch or pull on the front of your thigh? If you answered no, you likely have adequate hip extension needed for efficient running. If you answered yes, you need to begin to work on your hip mobility. Next, get on the floor on your hands and knees. Place a broom or pole across two objects at the same height as your trunk. Have someone video you for a good visual. With your knee bent and your foot flexed, start at parallel and extend your hip up toward the ceiling. Now, what do you see? Are you able to extend past parallel? If not, you have some work to do. Do you extend past parallel, but you have to arch your back or rotate your leg to do so? Then, let's get to work on incorporating a few simple hip mobility exercises. I suggest doing them on both sides. Number 1, kneeling hip flexor stretch with active liftoffs. First, get in a half kneeling position. I like to hold poles in front of you to help maintain a more upright posture for a better overall stretch. Lift your back foot off the ground as far as you can and hold 5 seconds. Perform this 5 times. Then push your pelvis forward and hold a static stretch for 30 seconds. Number 2, prone over cones. Lie on your stomach with your knee bent to 90 degrees and your foot flexed. Place a small cone or object just on the outside of your knee, then lift your leg very slow and controlled straight up toward the ceiling and out to the side over the cone and back. Perform 2 sets of 5 each side. Number 3, extension reach with ball. Stand with your lower leg on a physio ball. Hinge forward at your hips as you push the ball back behind you. Pause a 2 seconds, hold, then return to the starting position. Perform 10 reps each leg, working your way up to 5 or 10 second hold. As your hip extension improves, you can also try to keep your trunk more upright as you push that leg back. Holding poles or standing in front of a counter or a wall can help with this also. Number 4, massage ball release. Place a lacrosse ball or something similar right along the front of your hip, just under your hip bone. Make small movements from side to side or up and down until you find a tight spot. Hold 30 seconds to 1 minute, then relax. Each of these exercises can be performed daily until you see improvements. Then cut down to 2 to 3 days a week to maintain your improved mobility. Consistency is key. I hope this helps, and just remember, the hips don't lie.